In this video, we have a mnemonic to help us remember the mechanism of Bosentan. Bosentan is going to be a drug that gets commonly tested on the USMLE exams, and the mechanism of action is important to remember because it is often tested. So in order to remember the mechanism of Bosentan, use the En in Bosentan to remember that it is going to act on endothelin, and use the An to remember that it is going to be an endothelin antagonist. So Bosentan is a drug used to treat pulmonary hypertension, and the way it does that is by antagonizing the endothelin receptor. So here in this image, we have the endothelin pathway. Here we have the endothelium, which lines the blood vessels. And in the endothelium, we have this proendothelin that is going to be precursor to endothelin 1. And once endothelin 1 gets released, it can then bind to the endothelin receptor. And once it binds to this receptor, it is going to then trigger a cascade of events that can cause vasoconstriction of the smooth muscle, as well as an increase in the proliferation of the smooth muscle cells. So this is how endothelin can cause pulmonary hypertension. And the way Bosentan works is that it is going to antagonize this endothelin receptor. So it is going to prevent endothelin 1 from binding to this receptor. As a result, we're not going to have this cascade of events that can cause vasoconstriction and increase in proliferation of smooth muscle cells. So this is how Bosentan works. It works by antagonizing the endothelin receptor. And use this mnemonic to help you remember this mechanism.